The IQHC, or the Innovative Quality Healthcare Collaborative, is based on 3 foundational principles. First of all is communication between parties who normally don't communicate, and that's the employer, it's the payer being at the table and understanding it, and it's the physician group. Secondly is there's tremendous mutual respect for the role that everybody plays. Nobody wants to do the other person's role, and I've been so impressed with the corporations really saying to the physicians, you know, we need you to be the great physicians we know you are. Help us help you do that better. And of course, they appreciate the ear and know that the change makers that can really make a huge difference are the corporations.
What we're looking for with from the providers in the local community is, let's find what the best processes are for treating low back pain. And we chose that because it was part of the musculoskeletal conditions. It's very prevalent, and it's also very treatable through other means than surgery.
When you have neck pain, shoulder, back pain, things like that, and you take the surgeries that go with those and the emergency room visits and all the medications, that is the #1 most expensive expense. There have been 2 other initiatives, one in Portland and one in Seattle, that were transformative to their communities around musculoskeletal. So we know it can work. It's focused and it's something we can be effective on.
The mission and purpose is really to bring healthcare cost awareness to all the various stakeholders. So what we're trying to do is connect the employers or the ultimate purchasers of healthcare services with the physicians and hospitals in the community, the providers, the suppliers of healthcare services, and connect them to increase quality of care and patient safety. So this type of collaboration through IQHC is truly revolutionary, and that we're trying to get the employers to truly talk with the physicians and hospitals that treat their employees on how to get a better result and avoid the unnecessary waste that occurs in the healthcare system. Because it's 30% waste in the healthcare system. We can't afford that. So now today, healthcare cost is 17.8% of the GDP. The latest report from CMS is projecting that healthcare costs are going to go up 5.8% per year for the next 10 years. That means healthcare costs is projected to be at 20% of the GDP. If that happens, the United States economy will be bankrupt.
We benefit directors are not telling the doctors this is how you want to do it. We don't know. We don't practice medicine, but we're looking to you to say, how would you ideally do this? And we want to support you in making that happen.
There just hasn't been that communication. It's just there's not been a channel for us to even talk to the employers. We've got a big barrier in between us. It's called the insurance company, and that's who we have to talk to. Understanding that you guys are paying them to do a job, that's who we're talking to, and it's historically become an adversarial relationship, and it doesn't need to be. It needs to not be. We need to all be working for the patient, and if we're all keeping that in mind, we can do a better job. 30% waste is too much.
Do you think that's a reasonable number? Is
30%?
30%? Is it understated, right on point, or based on your exposure of what you see in the marketplace?
Oh yeah.
Okay.
Okay. I think so.
So Virginia, carriers have ACOs, they have patients at a medical home, they have performance networks. You've been exposed to all that, right? So what are you observing that's different in what the carriers offer in traditional metrics today?
One of the things that's different to me is that we're actually looking at the process of care and bringing in the evidence-based medicine that says this works most of the time or a lot of the time, and this doesn't necessarily work, or you should start here before you jump to there. And I think that is one piece that's been missing. I think a second piece that has been missing is the dialogue between us as the purchasers and you as the providers. I don't know if there are things in my plan design that are barriers for my patients, my team members, your patients, to actually do what you tell them to do that you know is going to work for them.
This is some data we pulled working with one of the major carriers in the marketplace. Of the providers that treat uncomplicated low back pain that had at least 100 patients, this is the number of hospital admissions with the adage, I have the sickest patients. This is a typical response. We can see the per patient cost ranges from $5,200 to $1,400. Now, if you were the CEO of the company, where do you want your people to go to if this is the price variation? And how do we really help people make good choices? Because the per unit is about the same. The variation in the treatment causes a lot of that cost differential, okay? That's what we really have to get our head around, is that supply chain variation. And so 15 years ago, I'm dating myself, when I was in Seattle, we launched the same initiative when I was with Aetna. And we worked with 6 employers, big ones, Costco, Starbucks, City of Seattle. And we met with Virginia Mason, because I got tired of contracting, of the unit cost arbitration. What do you want to pay? How much do you want? And that horse trading about the contract negotiation of building a network. So we got the suppliers together with employers, and their chief medical officer walked through how they treat back pain. Because when they came in and talked to their level 1 trauma, Annette King from Starbucks said, I appreciate level 1 trauma. I make coffee. I got baristas. They stand on a hard floor. They got back issues. Walk me through that. Well, you schedule an appointment. You see a primary care physician. You probably need to see a specialist. Now let's get you into an MRI, and then let's get you back in for the consult. And then 83% of the time you need physical therapy. So Annette's a pretty swift buyer. She was like, wait a minute. I got to pay for disability cost, replacement cost, overtime cost, and I'm paying for all this stuff when 83% of the time they just need PT? That's not working for me as the buyer. So VM, go back and tell me what you're going to do to change the process. So the CFO of Virginia Mason said, wait a minute, we get paid for all these steps in the episode treatment. We get paid for the MRI. I got radiologists, I got all these folks doing, I bought a machine to really do high-tech imaging that I got to pay for. But Annette said, that doesn't work for me. If you want to see my employees, I want to find evidence-based medicine. So they went back, and Virginia Mason changed their process of care. They said, Annette, how about we do same-day appointments? You'll walk in and you'll see a physiatrist. That physiatrist will determine what the process should be. Do they need an orthopedic specialist? It's more complex. Or do they need PT? Annette said, that works for me. Same-day appointments? I'll tell all my Starbucks employees that they can go to Virginia Mason and get same-day appointments for their back pain. And the result, they lower their healthcare costs. Less imaging, less physical therapy. How many times are you looking at your reports and you see PT for 80 visits? They did it on average less than 3 visits for physical therapy, following the evidence-based standards of care.
3 years from now, when we look back and ask how effective has this been, I'm a data guy, I'm a researcher. I know that we're going to look at the data and we're going to see that a person who had a back injury today was out of work 10 to 12 weeks. 3 years from now, it's going to be 10 to 15 days on average, and the physicians are going to like it a lot more, and the employers are going to be very happy by it. It's already here. I can already see it, feel it, smell it, and taste it because of the collaboration that the IQHC is bringing together.
We'll be able to say that we did something because we worked together and we made it better for the patients. And in so doing that, we've saved a bundle of costs for the employers who are paying the largest portion of the healthcare costs for the employees.